Constipation, and this was a talk, it was an online webinar just about a month ago from Dr. Melanie Schmidt in Canada, and she defined it as a lack of regular bowel motions which may cause pain and discomfort. There may also be incomplete elimination of stool in the natural reservoir, which is the sigmoid and rectal colon. It can be defined as acute or chronic. So acute is just now and again, all right? The NICE guidelines, which is the National Institute of Clinical Excellence, they define chronic constipation as having problems with constipation for more than 4 months. 4 months or more, all right? The other thing I want to bring up with this definition is that a lot of kids that I assess don't say it causes pain, okay? That they may have low awareness, and it's all to do with their sensory sensitivities, that they may not feel pain in the way that we would feel pain if we were constipated. The other thing that I want to bring up is that incomplete elimination of stools, all right? And that's, again, when I first started out, I was saying, nah, they can't be constipated, and they were. All right, that, like I've said, kids and individuals, they can have a poop every day, but it might not be complete emptying of their bowels every day. And over time, it becomes a poo traffic jam, and it just builds up and builds up, and the rectum can really stretch to 3 or 4 times the size. The kids might have frequent poops, more than 3 times a day. Well, I immediately would start thinking, you know, they're not emptying, they've probably got constipation as well, even if it looks normal. Now, I am really, really sorry. I'm really sorry about this slide. I have a gallery. I have a gallery of poos, right? And all of these ones are constipated poos. That one at the top, okay, that was from a 2-year-old. Okay, it was like a mountain. And she went maybe every week, and the parents said it was like she was in labour. And, you know, these kids were in quite a bit of pain and crying. And this was a cycle that was going on and on and on. And, yeah, as I say, they go to the doctors, they'll get a medication for it, lactulose. And yeah, it helps a wee bit with acute constipation, but it doesn't help when you've got chronic constipation like this. Lactulose will help to soften the poo, but it doesn't help expel the poo. Okay, you need more than that to get the bowel muscles working to actually get the poo out. So that's how confusing constipation can be. And it's fooled me over the years as well, you know. So it's, you know, I'm still learning a lot about the bowels. And it does annoy me because it's underreported, and it's not taken seriously enough. You know, how the impact that constipation can have on the child the young person, the individual, the family, and the wider community. I've had mums saying to me, I've had to give up work because my child was soiling so much at school that I was constantly having to go down to change them. It can affect the child in so many ways. You know, not just like, yeah, we've got, they're not pooping, they're pooping infrequently, or they're pooping too much, they've got soiling. If any of you have been constipated, how does it make you feel? Bloated, sluggish, lethargy, okay, tired. Often kids will come home and they've just got no energy. They're sad. They're honestly sad. Okay? So that's what I say. Sad poo, sad child, sad family. Without a doubt. Okay? They're on a short fuse and they get angry and lose their temper really quickly as well. The pre-poo child, they're just so twitchy and irritable and leave me alone, and they may not sleep well at night either. And you could imagine how that affects their schooling as well. Okay, so it impacts on all of their systems. Okay, not just thinking about the bowels. Okay, and this was in the UK. Richard's sister wrote about her brother Richard, and you know, Richard is 33 years of age and he had Down syndrome, but he also had mental health issues with psychosis and depression, but he had a wonderful sense of humour. But he had constipation all his life, and the parents were his poo monitors basically, and they understood and they ensured that he was able to relax, and they used to tell jokes and everything to help him relax every night so that he would empty his bowels. Remember, individuals with Down syndrome are at a high risk because they've got hypotonia, low muscle tone. So he left home, and in all the assessments, the professionals said very clearly that his constipation would always need close monitoring, and that they should always be aware that he may need help, you know, and checking to ensure that he had healthy bowels and was not becoming constipated. So his mental health deteriorated, and the GP had seen him, and you know, he was admitted to the mental health unit, and he died. And when they did the autopsy, 10 kilograms of faeces was removed from his bowels. That he'd been assessed by a GP and a psychiatrist, and they put the deterioration in his behaviour down to his mental health rather than actually looking at a physiological cause. So that's a rare event, because rarely does that happen. But it can, especially when these young, vulnerable adults with developmental delay, intellectual impairment, leave home. Yeah. So these are just a few of the facts which I've mentioned before, all right? And the percentage of constipation with kids or individuals with Down syndrome is definitely up in the 70% range. We've already mentioned a bit about the signs and symptoms of constipation, all right? You know, I think we've gone through all of them. A lot of kids, it's generally the afternoon that they'll, you know, and I'll ask them, when does the soiling tend to occur? Or in the afternoon, particularly when they're running around and doing exercise. That's when it is very much likely to leak out. So because kids know that that happens, some of them may not want to do exercise. So here are some of the signs that you will see in individuals that are trying their very best to stop Mr. Poo from coming out. Okay, that I hear that, you know, they'll kind of cross their legs, they'll walk on their tiptoes like they're ballet dancers, which means their buttocks are clenched. They'll kind of lean over things. They'll go and hide. It is confusing. Sometimes you're not sure because you've got an individual who can't verbally express what is happening to them. On top of that, if you know, I've mentioned about that these individuals do tend to have higher rates of anxiety and emotional dysregulation, which then has the physiological impact of slowing the gut down and slowing the bowel down as well. Medication is a biggie. Antipsychotics, antidepressants, anticonvulsants, iron medication. There's a lot of medications that can actually slow the gut down. The biggest cause for soiling is constipation. It's not a child being lazy or naughty, it's constipation. Okay, you maybe get 1 or 2% where they say it's encapricis. I don't like that word. I don't like these complicated words. But encapricis basically is that children soil in places where they shouldn't soil. You know, like in their mum's bed. I used to have a boy that used to poo under his mum's pillow. Yeah. But there was lots of trauma, lots of other things going on, and attachment issues, and yeah. So there you do get the odd one, but the majority, there is a physical cause. And the one thing that I always say is that it's not your fault. And I say it quite a few times. Okay, and when a person says, it just slips out, and I just didn't feel it, they're actually telling the truth. And there's no point tickling it with a few sachets of medicine. This is the gold standard. This is Malaxol, and we've used it for over 30 years in paediatric nursing or in paediatrics. Paediatric guidelines of New Zealand on the management of childhood constipation, this is the best. All right, is that it's gentle, it has minimal side effects, you know, it really does work. It has to be mixed with 125 mils of water, and then it can be added to just about anything. But there's kids that will just turn their nose up, okay? It's got a bit of a lemony flavour, but it's not unpalatable. But when kids decide that, or whatever, I'm not going to take it, that's it. you know, that it can be really hard to get them to take it. But I have lots of tips, hundreds of tips. The best one that I have always used that works for 90% of the kids is that you go out, or young people, is you go out and buy a box of lemonade popsicles, okay? Just the mini ones, 20 in a box. And they sup on it. They sup on the lemonade popsicle. And then they drink their happy poo medicine through a straw and a cup, okay? And then they finish supping on the lemonade popsicle. Okay, what is that doing? It's numbing their taste buds. And they're also getting a reward. But they also have to take it quickly or their lemonade popsicle will melt. Anyway, going back to this sort of overflow soiling, and that's where parents and caregivers get really frustrated because it just leaks out. And they don't even smell it. And they don't smell it because their body, this has been going on for such a long time, that their body becomes habituated to that smell. And then the parents get more annoyed when they'll say, look, you think you need to go to the toilet, you've gone and pooed your pants. And they'll say, no, I haven't, you know, because they're just so embarrassed. So embarrassed. And most kids know that this should not be happening, which is why they act out with denial, anger, you know, or it's just, they just sort of block it, that it's not happening. It's a protective mechanism because deep down they know that this isn't right, but they don't know how to fix it because they actually don't, they're not aware of when they actually need to empty their bowels. How do we get it back to a nice healthy bowel? And really, it's toilet gym to get the bowels back in trim and to get the poo in the loo. 5 minutes of sitting to make sure that there is complete elimination. We use blowing. Blowing, as I say, we've got this here that we can blow. Blowing bubbles, blowing windmills, lots of different things, because the muscles that we use for blowing are the same muscles that we use for pooping. Okay, I used to have a harmonica, but I got told it was too noisy. So I've taken it out my toilet treasure bag. All right, but I loved the harmonica because for the kids, they were just going huffing and puffing. And that's the movement you want. And they loved blowing, huffing and puffing. So this is my 4 E's for the management of chronic constipation. There's really 5, but evacuation, elimination, establish, educate and empower. So evacuation is that we've got to empty the bowel. Okay, there's no point tickling it with a few sachets. We've actually got to go hard and fast. We're going to smash it with high doses of Malaxol, and I have specific protocols for the different age groups. How do we know? How do we know that we have eliminated? It comes out clear, okay, like weak tea. That's what it's got to be like. If you stop too early, you're not going to win. All right, and it's not easy to do that. You know, it does take commitment, and I always say that they need at least a week off school, and they need a week at home, all right, so that they can get to the toilet, because they're going to get caught short. And I say to them, it's going to get worse before it gets better. So do use continence products. You know, do use pull-ups, do use pads in order to practically manage it. Especially if kids have got toilet avoidance and toilet fears, okay? It's the only way to practically manage it. Oh, going back, and if Malaxol is just not in agreement with the child, i.e. the child is just totally, no, no, not going to take it, not going to take it. Then we would move to Dulcolax drops, which is a stimulant. And I'm glad we've got it. It's taken a few years to get it through Pharmac, and it is under what we call a special authority. So the GP has to write away to say that the child has tried Malaxol and they've not been able to take it. So we need to prescribe the Dulcolax drops. And again, not just a few drops, it's really like 10 drops twice a day, 20 drops twice a day. The good thing about the Dulcolax is that it's only tiny little drops. There's you know, that there's no big hassle trying to get kids to take the medication. The downside about it is it does have side effects, and that most kids will complain of tummy cramps, tummy pain, and feeling a bit nauseous. And some kids just cannot tolerate it at all, where most kids will tolerate Malaxol. And yes, as I say, it's whatever it takes. I've put there a spoonful of sugar. It's whatever it takes, okay? You want to do the clear out once, and you want to do it right. And you don't want to have to stop midway. And again, as I say, continence products, I recommend that all the time, all right? No matter what the age group, because they're on high dose laxatives, they are going to have accidents, they are going to get caught short, they're not going to get to the toilet in time. Okay, elimination. So we've covered evacuation, elimination. Once they're empty, we want to keep them empty. How do we do that? All right, and this is where it could be really difficult. It's getting the dose right, getting the maintenance dose right. So I recommend doing what we call the sweet corn transit test, the sweet corn test, which I mentioned earlier on. And you can get that on the Continence New Zealand website. It's got the clear guidelines of how to actually do the sweet corn test. And in years gone by, I used to get them on a maintenance dose of 2 sachets, 3 sachets, right, that's great. We'll drop them down to 2, went okay for a wee while, and then they'd block up. Or they'd have them on 2, drop them, too big a drop. So I've changed that sort of the guidelines in that I drop it down 1/4 of a sachet at a time. I do a very slow withdrawal. Okay, so evacuation, elimination, and establish. All right, so we're looking at establishing a regular bowel routine. So remember, toilet, gym, to get the bowels in trim. And I call it wake up Mr. Poo routine with some young kids. Okay, and it is just the usual, okay, sit and rub, sit and rock, okay, sit and blow, and sit and chill. We do have to structure it. And most of us will empty about 20 to 30 minutes after we've eaten a good meal. So I try to say after breakfast, after lunch, after dinner. Okay, and we want to keep it fun. And there is an app that you could put on your phone called Mr. Poo Goes Home to Pooland. All right, and the kids absolutely love it. I've got a range of educational material to help these kids understand what's going on and what we need to do to actually fix this so that they can become the boss of their bowels. Tips for constipation, okay? If they're behaving differently, think bowels, okay? Get a baseline. I try and get, before I do an assessment, I ask for 2 weeks of what their bowels are doing. And really a really good bowel pattern. So I try and say, right, we need to give the maintenance medication, laxative, every afternoon after they've been to work or school or kindy or whatever. so that we can get them into a routine of them going to the toilet after dinner and after breakfast every single day. Now, I want to talk about psyllium husk. All right, and don't get it through your GP. Has anybody had Consul D? It's disgusting, isn't it? It's like trying to drink sawdust. I have this every day. Okay, Metamucil orange. I think it's got it in lime as well, if I mind right. And I want to share this story, okay, from a sister again. So, Douglas. Okay, this is Douglas. He's 44, and he's Down syndrome, autism, and dementia. And yeah, he had long periods of being dry overnight, but then he started to wet the bed frequently. And then he would start sort of like doing walks back and forward to the bathroom, back and forth, you know, and again they weren't sure what it was, but then, hey, turned out that he was constipated, and he was quite agitated during these times. He did have a healthy diet, and he lived between 4 of the family homes. And so they did manage his constipation, and they communicated with each other so that everybody was on the same page. But the one thing that really, like, he was always going to be semi-independent with his continence and his bowels. But the one thing that changed all of the, you know, his life in the family was actually Metamucil in his diet. That it draws water into the bowels and it plumps the bowels up. So it makes it much easier to pass a good, you know, soft stool. And it was a bit more intact and less sort of mushy. And as I say, they spent a lot of time before Metamucil. He couldn't wipe his bottom, and it was really messy wiping his bum. And they found that with the Metamucil that it was less, emptying his bowels was a less messy affair, that he didn't need to have a shower when, you know, he went to empty his bowels. So really, it's just, there's a lot of things that can support individuals that have issues with constipation, and that sometimes small changes can actually make a huge difference to the individual and to the whole family.